Do you really need your gallbladder? Hi, it's Dr. Van here. Let's talk about gallstones. Gallstones, or cholelithiasis, is a common surgical problem. It has an incidence of 10 to 15% and a slight female predominance. There are 3 main risk factors to the formation of these stones. 1. Excessive cholesterol. This may be due to excessive estrogen, which promotes biliary secretion of cholesterol, obesity, and, ironically, rapid weight loss, which stimulates biliary excretion of cholesterol. 2. Excessive bilirubinate, which is a waste product of heme. This may be due to increased production such as hemolytic anemia, Crohn's disease, and cystic fibrosis. 3. Bile stasis. This may be due to impaired bile flow secondary to bile duct strictures and parasitic infections. Historically, medical students remember the 5 F's of gallstone risk factors being fat, fair, female, fertile, and 40. However, it's probably not politically correct to recite that now. And if you actually consider these factors, they are just risk factors associated with excess cholesterol. To understand why these factors cause stones, it is important to understand the pathophysiology. Bile consists of 3 main components, being bile salts, cholesterol, and bilirubin. Bile salts make up the majority of the bile content and are the useful component of bile that act as fat emulsifiers to help with the digestion of fats. Cholesterol is secreted by the liver into bile, and its imbalance results in the formation of cholesterol stones, which represents around 90% of gallstones. Bilirubin is a waste product of hemoglobin, and its imbalance results in the formation of pigmented stones, which represents the remainder of gallstones. These gallstones can then cause problems by causing obstructions along the biliary ducts, ranging from biliary colic to cholecystitis, cholangitis, and pancreatitis. Biliary colic occurs when the gallstones block the gallbladder. The gallbladder contracts against an impacted stone, leading to a buildup of pressure. This causes right upper abdominal pain, which is where the gallbladder is located. The pain can last from 30 minutes to 6 hours, and is typically worse after eating, because that is when the gallbladder normally releases bile to help with the digestion of fats. Investigations for biliary colic include blood tests and imaging. Blood tests include full blood counts, electrolyte creatinine, liver function tests, C-reactive protein, and lipase. These will all be normal and are performed to assess the complications of gallstones, which I will cover in later topics. The imaging modality of choice is an abdominal ultrasound. An ultrasound is 90% sensitive and 99% specific for gallstones. Simple biliary colic is the presence of gallstones in absence of any complications. Gallstones are sometimes diagnosed on CT. These would only demonstrate around 75 to 80% of gallstones and are usually performed to assess for other causes of abdominal pain. The treatment options for biliary colic are either to treat with analgesia, medications as required, or to have an operation to remove the gallbladder, known as a cholecystectomy. Because gallstones last forever, most people with stones will likely suffer from multiple attacks. These patients will generally end up with a cholecystectomy. Having a cholecystectomy can also prevent the complications of gallstones, of which there are many. Check out my next video for further details on complications of gallstones. Thank you for watching. If you like this video, please like, subscribe, share, and comment for more videos.